Welcome to your new obsession, where every episode is packed with tools and science to help you become the best version of yourself. Whether you're a biohacking newbie or a seasoned pro, you're in the right place. Let's get started.
Hello and welcome back to the Biohacking Trainer Podcast. I'm your host, Luke Czaplewski, longevity enthusiast, personal trainer, and fellow biohacker. And today we're diving into a wellness modality that's been gaining popularity in health clubs, recovery centers, spas, and wellness clinics around the world. Halotherapy, also known as salt therapy. You've probably seen pictures of salt rooms with glowing pink walls, comfortable lounge chairs, and people relaxing while breathing in microscopic salt particles. But does it actually work? Can breathing salt improve your lungs, recovery, your immunity, or even athletic performance? Today we'll be breaking down essentially what halotherapy is, the history behind salt therapy, the science and proposed mechanisms, potential benefits for respiratory health, athletic performance considerations, skin health applications, and what the research says, who should and who should not be utilizing halotherapy, and how do you incorporate it into a wellness routine. So let's get started, shall we? So, halotherapy first comes from the Greek word halos, which means salt. Now, modern halotherapy involves breathing microscopic dry salt particles that are dispersed into the air through a device called a halo generator. Now, these generators actually crush the salt down into very fine particles that are about 0.5 microns in nature, so hard to see with the naked eye. The concept originated essentially from observations made in Eastern Europe centuries ago. Workers in salt mines appeared to experience fewer respiratory problems than the general population or those that worked in coal mines. This led researchers and physicians to investigate further whether the salt-rich environment itself was responsible for this or if there was some other factor. Now, today, halotherapy is commonly offered in salt rooms, salt caves, what's called a vitality booth or halo red booth, wellness centers, recovery facilities, or integrative health clinics. A typical session lasts anywhere from 20 to 45 minutes. During that session, dry pharmaceutical-grade sodium chloride, basically pure salt, particles are released into the air and inhaled into the respiratory tract. Now, unlike a saline spray or saltwater rinses, halotherapy uses dry, aerosolized salt particles that are designed essentially to travel deeper into your airways. Now, let's talk more about the mechanisms behind this. So there are three primary ways researchers believe halotherapy may influence health. One is a mucolytic effect. So the first mechanism is essentially helping break up mucus. So salt naturally attracts water, which when inhaled, microscopic salt particles may help thin mucus and improve mucus clearance from the respiratory tract. And this is one reason salt therapy has been studied in conditions involving congestion and excessive mucus production. So in some cases, I know in a practical sense, what I'll utilize it for if somebody's having, say, that buildup of phlegm in the back of the throat or a lot of mucus buildup within the sinus cavity. And what you'll see a lot of the times is from breathing in these salt particles, it causes you to excrete more of that mucus. So you're going to cough naturally, you're going to sneeze. Sometimes you have more of a runny nose going. Now, the other mechanism is salt has natural anti-inflammatory effects. So chronic inflammation within the respiratory system can contribute to symptoms like coughing, wheezing, or breathing difficulties. Some studies suggest that salt may help reduce inflammatory activities within the airways. While this area still requires further research, it may partially explain improvements reported by individuals with respiratory conditions. So for instance, within our practice, I see a lot of improvements for those that have COPD, clients who also suffer from asthma or seasonal flu allergies, where the inhalation of these microscopic salt particles significantly reduces the inflammation within their airways, causing them to breathe better and be able to take deeper breaths. Now, the third mechanism is Salt creates an antimicrobial environment. So salt has long been known for its antimicrobial properties. Researchers have proposed that inhaled salt particles may create an environment less favorable for certain microorganisms within the respiratory tract. It's going to kill off the cell wall of bacterial cells, which then causes the bacteria to die off. This is still an area of active investigation, but it is one of the most commonly cited mechanisms behind halotherapy treatments. The strongest body of research around halotherapy involves respiratory wellness. Many people seek salt therapy for seasonal allergies, chronic sinus congestion, asthma, COPD, bronchitis, or general breathing difficulties. It is very important to note, halotherapy is not a cure for respiratory diseases. However, a lot of individuals do report improvements within ease of breathing, reduced congestion, improved mucus clearance, reduced coughing frequency, and even better quality of life. So for instance, if someone can essentially breathe better and not have as many coughing spells, that's going to significantly increase their quality of life and make them feel better overall. Now, one reason this is particularly interesting is that respiratory health affects so many aspects of your overall wellness. So if you're breathing more efficiently, you're going to experience a lot of different benefits. So you're going to have better exercise tolerance, you're going to have improved sleep quality, you're going to have reduced fatigue and better recovery. So for individuals who struggle with chronic congestion or seasonal allergies, even a small improvement in airflow can make essentially a noticeable difference within your life. Now let's discuss something many listeners are probably interested in. Can halotherapy improve athletic performance? So the answer in short is potentially. It certainly can, but indirectly, athletes depend heavily on efficient respiratory function. So your lungs are responsible for one, delivering oxygen and removing carbon dioxide during exercise. If halotherapy essentially helps improve airway clearance and respiratory comfort, then it is going to create an environment where breathing feels easier during training. So potential benefits can include improved respiratory efficiency, reduced airway irritation, enhanced recovery after intense exercise, and better tolerance for endurance activities. In a practical sense, in our facility, we utilize halotherapy with a assault bike. So that way, our clientele can kind of push themselves from a cardiovascular standpoint and even a resistance standpoint, while at the same time improving their lung capacity and lung function and potentially help enhance their VO2 max numbers and, in short, essentially help improve overall athletic performance. Now, however, I do need to be careful. Current evidence does not support directly that halotherapy is a direct performance enhancing intervention yet. It's not necessarily going to magically increase your VO2 max overnight, but it is certainly a support for respiratory wellness and can contribute to overall training quality and recovery. But if you can plug it into your program, then it certainly can be a key component in improving the overall performance optimization strategy. So it's definitely something that I would highly recommend plugging into a off-season or an off-season program. Now, interestingly enough, halotherapy isn't only about breathing. Many people use salt therapy for skin-related concerns. So research has explored its role in conditions such as eczema, psoriasis, acne, dry skin. Salt may even help with supporting skin barrier functions. It can also reduce irritations, promote exfoliation, and improve overall skin appearance. Now, while results do vary for many users, a lot of different users do report improvements in skin comfort and appearance after regular sessions. This does essentially make halotherapy somewhat unique because it may simultaneously target both respiratory and skin health. And in our own practice, I've seen a lot of benefits for those that have rosacea and even psoriasis and eczema. Now, fun fact, from a skin standpoint, even from a respiratory health standpoint, if you combine the two of red light therapy and halotherapy, which is something we utilize a lot in our facility, you will see significant improvements from a skin standpoint Like I said, rosacea, eczema, psoriasis, major improvements. Now, whenever we do discuss wellness technologies, it is always important to separate hype from evidence. The research on halotherapy is certainly very, very promising. Now, again, it's still slightly developing. Some studies have demonstrated improvements in respiratory systems, lung function measures, quality of life scores, airway clearance. However, researchers have also pointed out a lot of different limitations. Typically, the limitations within these studies come from small sample sizes, inconsistent study designs, differences in equipments and protocols, and certainly a need for larger randomized controlled trials. Now, some of you may be wondering, where does that exactly leave us? The best conclusion right now is certainly that halotherapy is a low-risk wellness intervention that may provide very, very meaningful benefits for certain individuals, particularly those seeking respiratory support and even skin support. Now, from the scientific community, there still needs to be more high-quality research before we can fully make very strong claims in regards to a cure for respiratory symptoms and issues. However, in the meantime, we can certainly say it is very low risk and it can alleviate a lot of symptoms. Now, you may consider halotherapy if you experience seasonal allergies, if you deal with chronic congestion, if you are frequently feeling stuffy or restricted, if you want more respiratory support in your wellness or interested in recovery-focused wellness modalities, and you enjoy a relaxation-based wellness experience. However, you should always speak with a healthcare provider if you have severe levels of asthma, if you have an active respiratory infection. Now, of course, if you have uncontrolled cardiovascular conditions, I would advise staying away from any wellness modality in that regard. And lastly, if you have a very serious medical condition. Halotherapy essentially should complement, not replace, any sort of medical care. So if you're interested in trying halotherapy, consistency is typically key, just like with anything else in our world. So some facilities may recommend 2 to 3 sessions per week initially, with a reassessment after several weeks, and combining it with other healthy lifestyle practices. What I recommend typically just depends on the case. If it's somebody that has COPD or asthma, you could essentially do it every day if you wanted to. I would usually advise at least 3 times to potentially 5 times a week. Again, you do definitely want to do reassessments, and truly it always does come down to a healthy lifestyle practice. So the modality is great. However, you do need to focus on your exercise. You need to focus on proper nutrition, stress management, hydration, and recovery practices. No single intervention is the magic bullet. However, the real magic always comes from when healthy habits work together. So, halotherapy is a very interesting example of how simple environmental interventions may influence your health. While science is still evolving, the potential benefits for respiratory wellness, recovery, relaxation, and skin health make it a modality I would suggest exploring. Whether you're an athlete looking to support recovery or enhance your VO2 max numbers potentially, or you're somebody dealing with seasonal allergies or simply interested in biohacking your environment, halotherapy offers a unique and generally very low risk approach to wellness. Now, as always, stay curious, stay evidence-based, and remember that optimization starts with consistency. And if you enjoyed today's episode, please subscribe, leave a review, and share this podcast with somebody who's interested in optimizing their health naturally. Thank you for tuning in to the Biohacking Trainer Podcast. And until next time, stay healthy, stay curious, and we'll see you on the next one.